Howdy y'all, in this video today we're going to talk about social distancing. Does it work? Why do we do it? How to actually do it? What are my recommendations to prepare? And we'll answer common questions you guys may have about social distancing, including, can you go outside if you feel well? What to do if you live with grandparents or have grandparents who live nearby? Can you schedule play dates with your children and their friends? And other questions just like this one. Guys, let's talk about it. So you may have heard about social distancing all throughout the news about how to help stop the COVID-19 virus. And I can tell you, those countries that have done social distancing, it actually works. It helps to flatten that curve and prevent the spread of COVID-19. But why is it so important? Well, the main reason it's so important is that COVID-19 is so incredibly contagious. It is more contagious than the flu, and more people are spreading the virus without even realizing it. There are so many people out there that may actually be contaminated with COVID-19, but they're not having symptoms, or they don't realize that they have symptoms, and the virus ends up spreading like wildfire. And by practicing social distancing, we are actually able to flatten that curve. This is what we're trying to do currently in the COVID epidemic, is to flatten that curve, because there's going to be a point in time when we have too many people who are sick and we don't have the healthcare resources to take care of them. So how exactly do I recommend to do social distancing? I'm going to give you 5 tips on what I recommend. Tip number 1, if you feel well, stay at home. It doesn't matter if you feel good, if you feel the best you've ever felt, or you don't have any symptoms. Guess what? You need to stay at home. And not only to protect yourself from getting COVID-19, but to protect yourself from being a carrier of the virus to other people. Number 2, if you are sick, stay home. It doesn't matter if you have the flu, the cold, allergies, you just don't feel well. If you're feeling sick, stay home. Number 3, if you're feeling sick and you need to go to the doctor, use telemedicine. We are implementing telemedicine in my clinic, and so many other primary care providers and specialists are doing telemedicine. Take advantage of it, guys. It is awesome. All you have to do, ring, 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 ring. Hey, Dr. Islam, I feel sick. Okay, let me call in a medication for you. Boom! That's it. It is easy, it is safe, it is simple. Use it, because we are doing it to help protect you from COVID-19. Number 4, avoid crowds. If you see people in a crowd, if there's going to be an event that people are going to, if there's a tutoring engagement you want to go to, guess what? Don't go. You need to avoid those crowds. Those crowds are petri dishes of how the coronavirus can spread. And by you avoiding those crowds, you can avoid the spread of the virus. Number 5, if you do go outside, stay 6 feet away from people. Yes, if you literally need to get a ruler and use that ruler to say, hey, stop, you cannot cross this path, do it. It doesn't matter. Find a way to stay 6 feet away from anybody you come in contact with who is not a close family member or somebody who you've always been in close physical contact with. Stay 6 feet away, guys. Do it. So I'm going to give you now 3 recommendations on how to prepare for COVID-19 if you're going to self-isolate or do self-isolation. Tip number 1, get at least a 60 or even better, a 90-day supply of medications. These are prescription medications that you can get from your healthcare provider. I have been giving my patients at least a 90-day supply so that they can have enough medications to last them throughout this whole quarantine epidemic. Number 2, get enough over-the-counter medications. You may be surprised about how much you need some of the over-the-counter medications. So things I recommend: anti-diarrhea medication, anti-constipation medication, allergy medication, fever medication, thermometers, fluids with electrolytes. These are simple medications that are over the counter that we take for granted, especially if we're in a situation where we cannot leave the house or the pharmacy has run out of them. Number 3, I would recommend getting a 2-week supply of non-perishable foods. These are foods that can't get wasted or that don't have an expiration date, or that expiration date is so long in the future we should be okay. But these are the ways that you can prepare yourself for social distancing and quarantine as well. So there are a couple of questions that patients have asked me that I want to answer on this YouTube video. A patient asked me, hey Dr. Islam, can I go outside? And the answer is yes, go outside, enjoy nature. You can still walk, you can go outside, you can exercise. But if you go outside, use 6 feet as a measuring stick for how far you need to be apart from somebody else. Even if you're running or you have a running partner, stay 6 feet apart, either 6 feet above or 6 feet back, but use that 6-foot marker as a way to keep yourself separated. So another question a patient asked me, hey Dr. Islam, I have parents that live close by. Can I just go visit them, bring them groceries? Or I have parents who live with me. What can I do to protect them? Well, if you have parents who live nearby, my recommendation is to not visit them. You need to protect them from COVID-19, and you may be a carrier yourself. So do things that you can normally do without having to physically be near them. FaceTime them, talk with them on the phone, buy them groceries, but leave them at the doorstep so they can pick it up. Run their errands for them, but don't be in contact with them. If you live with your parents or if you live with people over the age of 65, I would highly recommend that you isolate yourself as much as you can. Wash your hands and try to not have anybody else enter the house who are not close contacts. The elderly population is the population that's getting sicker and sicker and sicker from COVID-19, and this is the age group that we have to protect at all costs. So another patient asked me, hey Dr. Islam, I feel fantastic, I feel great, I know I'm not sick, do I still need to practice social distancing? Yes! For gosh sake, yes! It doesn't matter how you feel. You need to practice social distancing. I cannot emphasize that enough. If you feel fantastic, guess what? You're like the rest of us. You need to stay home. So another question a patient asked me, hey Dr. Islam, I'm going crazy with my kids being home. Can I just schedule a play date? So the answer to that is no. Unfortunately, you can't. Listen, I've got kids at home. They've been home for a long time. They are going stir crazy, but I am trying to protect them and protect other families as well. So no, do not schedule a play date. This is not spring break. Unfortunately, this is a very serious situation, and I would not recommend for you to have anybody else in that house who's not already there or who's not already a close contact. Another question a patient asked me, hey Dr. Islam, can I get takeout or delivery? Well, so far, the answer to that question seems to be yes, it is okay. There's been no evidence of transfer of COVID-19 in a takeout situation or from somebody delivering food. But I would recommend that you still do the normal practices that we want you to do. Washing your hands, maintaining 6 feet away from somebody who's delivering that food, and keeping yourself isolated as much as you can. But so far, it does seem to be safe to order takeout if you need to. Another question that a patient asked me, hey Dr. Islam, is it safe to get packages from Amazon or from a place that may be a hotspot? So far, the WHO, the World Health Organization, does recommend that it is safe to get a package even if it's from a hotspot. So yes, it is safe as of now to go and get a package from Amazon or from any other place that you ordered it. Alright guys, I want to thank you for watching this video. If you have questions on COVID-19, comment down below. I'd love to hear what you guys have to say. But thank you for watching this video. Don't forget to smash that like button so you can get more videos just like this one. But if you're interested in more videos on COVID-19, don't forget to click here. But guys, stay happy, stay healthy, and stay safe.